Narcan, also known as naloxone, is a life-saving medication that has gained significant attention in recent years due to the ongoing opioid epidemic. As a healthcare professional, I have witnessed firsthand the devastating impact of opioid overdoses and the crucial role Narcan plays in reversing their effects. In this comprehensive video, we will delve into the various aspects of Narcan, including its common applications, advantages, potential adverse reactions, dosage recommendations, and associated dangers. Narcan is an opioid antagonist, which means it works by blocking the effects of opioids on the brain and body. It is administered to individuals who have overdosed on opioids, such as heroin, fentanyl, or prescription painkillers. By reversing the respiratory depression caused by opioid overdose, Narcan can prevent brain damage and save lives. As we explore the intricacies of Narcan, it is essential to understand its significance in the fight against the opioid crisis. By arming ourselves with knowledge, we can better equip ourselves to respond effectively in emergency situations and contribute to efforts aimed at reducing the devastating toll of opioid addiction. Common applications of Narcan. Narcan is primarily used in emergency situations to reverse the effects of an opioid overdose. Its primary application is in the following scenarios. Overdose treatment. When an individual has overdosed on opioids, Narcan is administered to counteract the respiratory depression and other life-threatening symptoms caused by the overdose. It is often used by emergency medical services, EMS, personnel, first responders, and in emergency departments. Opioid detoxification. In some cases, Narcan may be used during the detoxification process for individuals seeking treatment for opioid addiction. It can help alleviate withdrawal symptoms and facilitate the transition to medication-assisted treatment or other recovery programs. Accidental exposure. Narcan can be used to reverse the effects of accidental opioid exposure, such as in cases where a child accidentally ingests an opioid medication or when a healthcare worker experiences an occupational exposure. Surgical procedures. In certain surgical procedures, Narcan may be used to reverse the effects of opioid anesthesia or pain medication, allowing for a quicker recovery and discharge from the hospital. It is important to note that Narcan should only be administered by trained individuals or under the guidance of medical professionals. Improper use or administration can lead to adverse reactions or ineffective treatment. Advantages of using Narcan. The use of Narcan offers several significant advantages in the fight against opioid overdoses. Life-saving potential. Narcan has the ability to rapidly reverse the respiratory depression caused by opioid overdose, which is often the primary cause of death in such cases. By restoring normal breathing, Narcan can prevent brain damage and save lives. Accessibility. Narcan is becoming increasingly accessible to the general public, with many states and organizations implementing programs to distribute it to individuals at risk of witnessing or experiencing an opioid overdose. This accessibility can greatly increase the chances of timely intervention. Ease of administration. Narcan can be administered in various forms, including nasal spray and intramuscular injection. The nasal spray, in particular, is easy to use and does not require specialized medical training, making it suitable for bystanders to administer in emergency situations. Rapid onset of action. Narcan typically begins to reverse the effects of an opioid overdose within 2-3 minutes of administration, providing a crucial window of opportunity for medical intervention. Safe and non-addictive. Narcan itself is a non-addictive substance and is generally considered safe when used as directed. It does not produce any euphoric or harmful effects when administered to individuals who have not consumed opioids. Potential adverse reactions of Narcan. While Narcan is generally considered safe, there are potential adverse reactions that may occur, particularly in specific populations or situations. Some of these reactions include withdrawal symptoms. In individuals who are physically dependent on opioids, the administration of Narcan can precipitate acute withdrawal symptoms, such as nausea, vomiting, diarrhea, muscle cramps, and agitation. These symptoms can be severe and may require medical management. Pulmonary edema. In rare cases, Narcan administration has been associated with the development of pulmonary edema, fluid buildup in the lungs, particularly in individuals with underlying cardiovascular or respiratory conditions. Seizures. While uncommon, seizures have been reported in some cases following Narcan administration, especially in individuals with a history of seizure disorders or head injuries. Arrhythmias. Narcan may potentially cause or exacerbate cardiac arrhythmias, abnormal heart rhythms, in individuals with underlying heart conditions or those taking certain medications. Aggressive behavior. In some cases, individuals who have been revived with Narcan may exhibit aggressive or combative behavior due to the sudden onset of opioid withdrawal symptoms. It is crucial to monitor individuals who have received Narcan for any adverse reactions and seek prompt medical attention if necessary. Healthcare professionals should be aware of these potential risks and take appropriate precautions when administering Narcan. Dosage recommendations for Narcan. The dosage of Narcan can vary depending on the specific situation and the severity of the opioid overdose. Generally, the following dosage recommendations are provided. Nasal spray. Initial dose: 4 mg, 1 nasal spray into 1 nostril. If no response after 2-3 minutes, an additional 4 mg dose may be administered. Intramuscular or intravenous injection. Initial dose: 0, 4 mg to 2 mg. If no response after 2-3 minutes, additional doses of 0, 4 mg to 2 mg may be administered every 2-3 minutes until the desired response is achieved. It is important to note that dosage recommendations may vary based on specific guidelines and protocols established by local authorities or healthcare organizations. In some cases, higher or repeated doses may be required, especially in cases of severe opioid overdose or exposure to potent synthetic opioids like fentanyl. Narcan should always be administered under the guidance of a healthcare professional or trained individual, and emergency medical services should be contacted immediately in the event of an opioid overdose. Dangers associated with Narcan. While Narcan is a life-saving medication, there are certain dangers and risks associated with its use that should be considered. Incomplete reversal. In some cases, particularly with potent synthetic opioids like fentanyl, the effects of Narcan may wear off before the opioid is fully eliminated from the body. This can lead to a return of respiratory depression and overdose symptoms, requiring additional doses of Narcan or medical intervention. Withdrawal symptoms. As mentioned earlier, the administration of Narcan can precipitate acute withdrawal symptoms in individuals who are physically dependent on opioids. These withdrawal symptoms can be severe and may require medical management. Aggressive behavior. Individuals who have been revived with Narcan may exhibit aggressive or combative behavior due to the sudden onset of opioid withdrawal symptoms. This can pose a risk to bystanders or emergency responders. Relapse and overdose. While Narcan can temporarily reverse an opioid overdose, it does not address the underlying addiction or prevent future overdoses. Individuals who have been revived with Narcan may be at risk of relapsing and experiencing another overdose if they continue to use opioids without seeking appropriate treatment and support. Improper administration. Improper administration of Narcan, such as using an incorrect dose or route, can lead to ineffective treatment or potential adverse reactions. It is crucial to emphasize that Narcan should only be administered by trained individuals or under the guidance of medical professionals. Proper education and training on the use of Narcan, as well as an understanding of its limitations and potential risks, are essential for ensuring its safe and effective use. Narcan and opioid overdose. The opioid epidemic has become a public health crisis of significant proportions, with overdose deaths reaching staggering levels in recent years. Narcan plays a vital role in combating this crisis by providing a means to rapidly reverse the effects of an opioid overdose and potentially save lives. Opioid overdoses are characterized by a range of symptoms, including respiratory depression, slow or shallow breathing, pinpoint pupils, unconsciousness, bluish tint to the skin, cyanosis, gurgling or snoring sounds. In the event of an opioid overdose, time is of the essence, as respiratory depression can quickly lead to brain damage or death if not addressed promptly. Narcan acts as a crucial intervention by blocking the effects of opioids on the brain and restoring normal breathing. It is important to recognize that Narcan is a temporary solution and does not address the underlying addiction or prevent future overdoses. Individuals who have been revived with Narcan should seek immediate medical attention and consider entering a comprehensive treatment program to address their substance use disorder. Narcan availability and accessibility. Recognizing the critical importance of Narcan in saving lives during opioid overdoses, efforts have been made to increase its availability and accessibility. Many states and organizations have implemented programs to distribute Narcan to individuals at risk of witnessing or experiencing an opioid overdose, as well as to first responders and emergency personnel. Narcan is available in various forms, including nasal spray, a pre-filled, needle-free device that allows for easy administration through the nasal passages. Intramuscular injection, a pre-filled syringe or vial for intramuscular injection. Intravenous injection, a vial for intravenous administration in medical settings. In many areas, Narcan is available without a prescription, allowing individuals to obtain it from pharmacies or through community-based distribution programs. Additionally, some states have implemented standing orders or collaborative practice agreements that enable pharmacists to dispense Narcan directly to individuals at risk or their caregivers. It is important to note that laws and regulations regarding Narcan availability and distribution may vary by location. Individuals should consult with their healthcare providers, local pharmacies, or community organizations to learn about the specific resources and programs available in their area. Narcan training and education. While Narcan is becoming more widely available, it is crucial that individuals receive proper training and education on its use. Improper administration or lack of knowledge about Narcan's limitations can lead to ineffective treatment or potential adverse reactions. Many organizations and healthcare providers offer training programs on the recognition of opioid overdose symptoms and the proper administration of Narcan. These training sessions typically cover identifying opioid overdose symptoms, recognizing the signs and symptoms of an opioid overdose, such as respiratory depression, pinpoint pupils, and unconsciousness, administering Narcan, step-by-step instructions on how to properly administer Narcan, whether through nasal spray or intramuscular injection, post-administration care, guidance on monitoring the individual after Narcan administration, providing rescue breaths if necessary, and seeking emergency medical assistance, overdose prevention strategies, information on harm reduction approaches, safe storage and disposal of opioid medications, and resources for addiction treatment and support. Narcan training programs are often targeted towards individuals at high risk of witnessing or experiencing an opioid overdose, such as those with opioid use disorders, their family members or caregivers, and first responders or community organizations. By empowering individuals with the knowledge and skills to recognize and respond to opioid overdoses, these training programs can play a vital role in saving lives and addressing the ongoing opioid crisis. Conclusion: Narcan, or naloxone, is a life-saving medication that has become an essential tool in the fight against the opioid epidemic. Its ability to rapidly reverse the effects of an opioid overdose and prevent brain damage or death has made it a crucial intervention in emergency situations. Throughout this video, we have explored the various aspects of Narcan, including its common applications, advantages, potential adverse reactions, dosage recommendations, and associated dangers. We have also discussed the importance of Narcan in combating opioid overdoses, its availability and accessibility, and the need for proper training and education on its use. While Narcan is a powerful tool, it is important to recognize that it is a temporary solution and does not address the underlying addiction or prevent future overdoses. Individuals who have been revived with Narcan should seek immediate medical attention and consider entering a comprehensive treatment program to address their substance use disorder. As healthcare professionals and members of the community, it is our collective responsibility to support efforts aimed at increasing Narcan availability, promoting education and training, and advocating for comprehensive strategies to address the opioid crisis. By working together and utilizing the life-saving potential of Narcan, we can make a significant impact in reducing the devastating toll of opioid overdoses and saving lives. If you or someone you know is struggling with opioid addiction, seek help immediately. There are numerous resources available, including addiction treatment centers, support groups, and hotlines. Remember, recovery is possible, and every life is worth saving.